cervical cancer screening should be a routine test. We have a national cancer screening program, and what they use is something they call VIA, or what we are using is acetic acid. So what we do, we put acetic acid on the cervix and we look at it. So what happens is that if you actually have abnormal cellular changes, it will take up the acetic acid.
Are we talking about screening every year for women who are sexually active? What are we looking at in terms of the frequency of the testing and the screening?
So it's actually advisable to start your screening by age 21 if you're sexually active, or at least 3 years after the onset of sexual debut. So what we look at is once we start the screening, between the age of 20 to 29, we recommend a pap smear is just adequate every 3 years.
Every 3 years. All right, so walk us through how exactly that is done.
What we need are cells from the cervix. So the cervix is the lower part of the uterus. To take anything from the cervix, then I need to access that part through the vaginal space. For me to get there, then naturally I will use a gadget like this. These ones, we call them speculums. A speculum just opens up the vaginal space so that I'm able to see the cervix. The beautiful thing about an examination with a speculum is that you are able to actually pick other things, infections, abnormal discharges, any lesion that is not normal. You'll be able to pick it quickly because that's a pelvic examination. But once I'm able to access the cervix, then I will take, this is something we call a cytobrush. So I'm able to see that cervix. So I'll get that I don't know if you can see that.
Yes.
So I'll get it to the cervix, and usually we just turn it. It's a very simple.
So it's like a brush.
It's a brush. The speculum helps to open up because the cervix is right in there. And what I do is that I will get my brush in there, and you realize this brush has
bristles.
Yes, but it's you can see that projection in the middle. This goes inside the cervical canal like that, because when we are getting cells, we want to get cells from something we call the endocervix, or the inside of the cervix, and we also get from the ectocervix out there. So we do that, we rotate that nicely, so we are collecting our cells. Now what we do naturally, we have 2 options. So I can do this smear on a slide and then fix it for the pathologist to talk about it. Or I can actually collect that, put it in a liquid-based solution, and take it again for the pathologist to look at those cells. And then the pathologist should be able to describe these cells for us. Now, there's something I would like our viewers to know. Number 1, a pap smear is a screening test. It does not tell that you have cancer, but it will tell us that there's something wrong with your cells, if there is, or it will tell us there's nothing wrong. So most of the time you will get a report from the pathologist that will tell you normal, or it will tell you we have a low grade, or it will tell you we have high grade. And with that, there's also a journey to it. So your gynecologist should be able to explain to you how that journey goes. So if, for example, you have abnormal cells, we have the low grade, you will get advice that we can repeat that pap in 6 months. What does that tell you? That your body can actually clear the abnormal cells. So if I repeat in 6 months and that has not happened, then we might need to move to the next step. But if I repeat in 6 months and it has happened, then we continue with the cervical